A nursing student who beat Candida, SIBO, brain fog, and chronic fatigue. In just 2 weeks, he solved all of these symptoms using the mind-gut immunity approach. Lots of great lessons here. You're going to want to watch this. Hi there, I'm Dr. Chanu Dasari, a surgeon who specializes in reversing gut microbiome dysfunction and autoimmune inflammation. My technique for reversing symptoms in as little as 6 weeks has helped thousands of patients over the years and is called the mind-gut immunity method. And if you would like to learn more, visit mgiclinic.com and request a discovery call. Now, in this upcoming video, you'll meet one of my clients, Michael, who was diagnosed with small intestinal bacterial overgrowth and histamine intolerance. He also had candida overgrowth, chronic fatigue, and brain fog. All of his symptoms improved dramatically once he started our program. Also, just prior to our interview, he just got accepted into nursing school, and you can even see him in his interview shirt and tie from earlier in the day. Okay. Tell me. What's up?
But yeah, shouldn't think. Yeah, it was like like a matter of 4 weeks. I just got everything together, and so yeah,
Congrats.
yeah, it's four.
So you're starting nursing school, right?
Yes, yeah.
When is that?
It starts on the 23rd, so in 2 more weeks.
That's great.
Yeah, it was like just everything fell into place, and um, like starting with my health, because this wouldn't have been possible without me implementing everything and like fully believing in it. Because I feel like I went through patterns of where I was like, okay, like, I would feel good, but not that good. And then, but I wasn't committing as hard. And like these past few weeks, the diet has just been like on point, nothing but shakes, and like everything's just been smooth. And so I know what I needed to do. Didn't I didn't do it. And I was like slacked off, and then I was mad because I slacked off.
This
Because I
is
felt like
great.
crap.
So
But
this is awesome. I guess what do you even know? I mean, this is all new. This whole plan to go to nursing school is like a new thing, right? I mean,
oh yeah, this was like a span of like 4 weeks, like a month. Because I mean, this I wouldn't even be thinking about nursing school at all if I wasn't feeling better. Like it was just I like couldn't even work a job or do anything. Like, I was struggling.
yeah.
I was on the struggle bus. So, and then
What were some of your symptoms that got better? And now
uh,
you're perfectly fine now, but like
oh yeah,
you were dealing with a lot of stuff, like just a few. I mean,
the brain fog, fatigue, like bloating beyond no other. Like I woke up today, and then my girlfriend was like, was your stomach always that flat? And I was like, this is how it's supposed to be. Like you should wake up and your stomach is flat. Like you don't like that's just bloated. Like if you wake up with bloat, it's like that's not normal.
yeah.
So
Well, that's great. I wasn't expecting to hear any of this, by the way. I didn't know this plan of yours. I know you were taking some exams and things. I didn't quite get. I didn't realize like you took the last spot. You got
yeah,
the.
like I was literally biting nails. Like I had my interview,
When was
and they
your
were
interview? Just like literally just now?
just now. Yeah, it was at
And
ten thirty. It
they
was at
told
ten
you got
thirty.
they told you got in and told you took the last spot in the school.
Yep. Yeah, they were like so. Um, there was actually another interview with another candidate, and thank God she didn't make it because something with her babysitter or something. So I'm like, well, that's already a bad indicator, like that she couldn't get a babysitter for just an interview, and you got to be in class Monday through Friday, 8 to 5. So, but yeah, either way, like I was just like, it just all fell into place. Um, the financial aid lady was just like, she's like, it was an act of God that you got in. So
Wow, it's meant. This is
it was
one of
meant
those
to be.
meant to be kind of things, right? It's like you couldn't have even made a plan more perfect, really.
Oh, it really kind of it fell into place perfectly
I'm
these
so
past
happy for you.
couple of weeks. And with having my clear mind and just my general happiness too, like my happiness is back too. I feel like the candida was probably like
Yeah.
lining my intestines and
Making your
stopping.
IBS worse, making your brain fog worse. I mean, you had a lot of symptoms. Like, what were all the symptoms you had?
Well, it's like, what didn't I have? I literally felt like I was dying. Like I was like, okay, I didn't know if I was gonna make it like a couple, maybe a couple of years. I was like, okay, am I gonna make it a couple of years? Now I'm like, with the diet regimen and just like everything that I've been opened up to, with like herbal stuff and just like it's just so, it feeds your body so well, and the antioxidants and just everything keeps you from aging. And so now I'm looking like, okay, 90's not that bad. Like
That's great. I know before you joined this program, you had a lot of doctors involved in your care off and on. What would you say, what were they doing for you? And what would you say were some of their limitations?
um, I would just say just their lack of knowledge on it. I don't think any of them were really familiar with SIBO or Candida. Like they just, I think it was like a foreign thing, and they were gastroenterologists or internal specialists. So it's really surprising that it was really overlooked by them, and they were going to more drastic things like celiac or
Yeah.
um, like even HIV. She was like, let's get you tested for HIV. I'm like, I've done HIV STD tests, and you know, it's not HIV. Like, um, so it's just scary going from that to like knowing what it was. Um, like especially as I went, because I was like, at first I was thinking that it was more SIBO, and like I was just focusing on SIBO, and then once I started focusing on, I think maybe I had a combination of the two. It could
Yeah.
have been like,
This all falls under, I know people subdivide it out, right? Like if you have bacterial overgrowth, you have a SIBO, but if you have fungal overgrowth, you can have Candida. So it all falls under the window of, or the overarching theme of gut microbiome dysfunction, right? So a lot of strategies that we've used together, and even ones that you've discovered on your own, you combine them all together and you see, and you get better pretty fast. It's not like you got to wait like years and years or
it's like
months.
2 weeks, like literally,
No,
like
right.
2 weeks ago,
Yes.
I was like iffy.
All of these things fall under
Mushrooms
the
and stuff like
category
that,
of
reishi
phyto
mushroom.
oils, and you're right, the mushrooms, the phyto oils, these all fall under the category of phytonutrients. And it's like you just find the right kind of milieu, the right pattern, and then and everybody's different, as you know. Like we had to customize everything for you, and go through this long process, long back and
Oh
forth,
yeah.
figure out what happened. But when you know that it's dialed in, and you feel it, and you feel it almost immediately, and the results can be very exciting. I mean, it's very encouraging.
Oh yeah, it's so much. And now like it's like the diet, and like it's just not, it's something that you can do anytime. Like antibiotics, you have to go, or antifungals, you have to go to a doctor. They have to like diagnose you. They gotta
They don't
run
even
tests to
work.
make
They only
sure it
work for like
is.
2 or 3 days, and then like you're back to square one because you don't have a long-term maintenance strategy.
Yeah, exactly. Yeah, and the best way to beat candida is beating it for like 3 months solid. Like you got to dial
You
in with the
build up that
diet for three
resilience.
months,
Yeah.
and you kill it for like 3 months basically to completely eradicate it. From what I was reading, I'm sure some
Well,
people are different.
it's
Some
the
people
same way.
can.
The longer and longer you are symptom free, the more resilience you build up. You're not as delicate anymore, So, and I talk about this all the time. Like once you're feeling great, let's keep this going for a little bit,
Yeah,
and
just keep.
then like see it, and then slowly transition back to some of the other things that you've been doing. Oh, I have a question. Okay. So you're going to be involved in patient care. You're going to be in health. I mean, you're going to be elbow deep in like healthcare now,
Oh yeah.
taking care of sick patients. I normally ask as the last, kind of a wrap up question. I'm like, what are you looking forward to the most? But I'm going to ask you a little different question. I'm going to say, how has this experience, how is it going to change your medical practice? How is it going to change your approach to patient care? I'm just curious. I'm curious.
I was thinking about that too, honestly. I was like, this knowledge that I've learned, just so like from the supplements
The
um
video, the
and the
academy,
diets,
the diet.
and yeah, especially like the nutrients. I think that's like the best thing. You feed your body the best stuff, and you just like your skin changes, like
Yeah.
like you could heal yourself from the inside out. It's like this is honestly like kind of a not a kept secret, but I just think nobody really knows about it. Like no one knows that they can fix their bodies. I mean, you could probably fix. I'm not gonna like have a black helicopter come and get me, but you could probably fix like cancer or something like just with this diet in feeding your stuff, like feeding your body the right probiotics. I mean, probiotics, they build your immune system to allow you to like your body to function properly. So I
Yeah.
mean, it's a potent treatment that is way underlooked because everyone's so busy relying on antibiotics, and that's how we're getting all these resistant strains of you know candida or whatever it is, because
Super bugs.
yeah, they're like we're just throwing like antibiotics in it, and it's like, well, that's not going to kill candida. That's going to like that's just going to make it worse. And even when I asked you, I was like, please give me antibiotics, and you were like, no, and I was like
And I told you, just wait, just give it a chance.
and so
Both
now I'm like
trying to
kicking
convince
myself in the ass.
people,
I'm like,
trying to convince people like I will get rid of SIBO or I will get rid of your candida without antibiotics. Oh my God, that is a conversation unto itself. Like just trying to convince people that there is a way to fix this problem that does not involve a temporary, like, kind of like a, temporary antibiotic. It's like I have to almost justify my reasoning and educate them every time. And I know you were skeptical, now you're not, but
oh yeah, I was for sure skeptical. I mean, that was like a month ago. Like literally. I was like, um, I was just like, oh yeah. And then, but I mean, that's when I was still like kind of leaning into SIBO. Um, and then once I was like, okay, this is for sure candida. I like looked at my stool and I was like, okay, that looks like a fungus. That doesn't look like a bacteria. That's um so, and just like apple cider vinegar and stuff like that to like help
yeah, there's a lot. I mean,
break it down. There's just
like
yeah,
this
there's
whole kind of thing, whole regimen for it, right? I know.
yeah, there's just so much out there that, and even before I didn't realize that I was taking apple cider vinegar like maybe a couple years ago. So I may have had this for a really long time. And like probably like 3 4 years, maybe even longer. Maybe it just took a long time for it to build up to where, or get into my digestive system, um, and like cripple my digestive system.
Mhm.
But I could have had it, since I was young, and then just my immune system was so good, it was fighting it off or
Right,
whatever. I mean, because we all have an amount of yeast in us. It's
right.
just
Just baseline amounts, right? Yeah.
it's just once it gets out of hand, your body starts freaking out. It's
So what are you looking
taking
forward to
over.
the most in nursing? I mean, congrats, first of all.
Thank
I mean,
you.
this is hot off the press. Like you just found out you got in like literally before you got on this call, right? I mean, like
I'm
you're
still.
on
I don't. It
cloud
doesn't
nine
even
right
feel
now.
real to me, honestly. I feel like I literally feel
That's
like because
great.
I actually have to go take my drug test, which I'll be fine
Good.
after this.
Yeah.
But I have to like submit that and my high school diploma and all that good stuff. But I'm like, it'll feel real when all that's submitted and done.
You're starting
To,
nursing college. I know.
tomorrow, I'll be like, yes, I'll wake up. And I've been waking up early too. Like, I mean, when you're on the diet and you're just like following it rigorously, you feel great. You wake up. I wake up like I don't even need an alarm. Like these past couple of weeks, just been like popping up out of bed at like, you know, 6 o'clock. Like,
I
so
think
it's
I think hearing your story is going to inspire your patients. I think hearing your story is going to inspire a lot of people out there suffering from SIBO, Candida, IBS, even chronic fatigue, brain fog. A lot of these things, and you know, in my clinic, I see people with autoimmune disease. I'm seeing people with digestive dysfunction, these really hard problems, and not hard in the sense that hard to fix. There's actually a pretty reliable fix for it, but I feel like, you know, the discussion's always about like the medical side of things, and while all of what we're talking about is in the literature, there's plenty of research to back it up. I feel like a lot of these sort of very effective strategies for fixing these are not all in one place. They're not like easy to find. They're not easy to understand. They're not easy to vet on the internet. And so I'm trying to increase, just like you, like, you know, trying to bring out some like success stories and talk about things in a different way so that people get a more balanced view of what's going on.
oh yeah. I mean, I always knew that this was the approach that I wanted to take. Um, I just didn't know like where to go. Like you just don't like because I mean you go to
Having guidance helps.
yeah, oh yeah, exactly. When I saw you and I like saw your videos and stuff, I was just like, okay, this is the guy. And then when I met you, I was like, this is even more the guy. Like and
Well,
yeah,
you
I mean, we clicked off right away and um so it's cool. Honestly, like you had a lot of patience with me. There's
well, don't worry about it. I have a lot of patience with most. Listen, there's a back and forth with everyone that we have to customize the plan for everyone. You know, it helped that you know that you were playing along, you were giving us feedback, you telling us what worked, what didn't work. It's not a like one size. Everybody thinks it's like a one size fits all kind of a thing, and it's really not. There are a bunch of core principles, and there are a lot of strategies that I utilize, and I don't know of any other people that utilize them and get the results that I do, but there is that customization piece that I tell people. It's not as easy as just looking at a piece of paper and following a protocol. It's very in depth. There's a lot of handhold. I mean, I don't even know if I had to count the number of text messages and phone calls and meetings that we've had. I mean, it's easily possibly in the hundreds, thousands. I don't even know the
oh
numbers,
yeah.
but
I mean,
it's okay because now you're better. And guess what? You're going to be a nurse and you're going to be helping other patients. And this is great. Like I love this. I mean, we couldn't have timed this check-in any better,
we
really.
honestly could have timed this any better. Like
Yeah.
it worked. I mean, because these past couple of weeks I was just buried in the T's, just
Yeah.
studying and studying. Because
Exams and things. Yeah.
that without passing that, they wouldn't even consider me. Literally.
Good.
So, but
Well, congratulations.
thank you.
And I'm really looking forward to the next chapter.
Yeah, me too. And thank you for giving me these like lifelong tools. Like literally, you gave me a lifelong tool that like can help with my entire family. Like literally, to anyone that I come across that is like not feeling good, I'm able to be like, okay, well, try this out or try this out, or look into herbal, like the herbal side of things rather than just going straight for antibiotics. And um, I picked up a part-time job at with Teladoc.
Oh,
And so I started that recently. And so I was like, I've been getting all these people and they're like, I just need moxicillin. I just need moxicillin. And I'm like, you haven't even run tests. Like, how do you know you need moxicillin? I'm like, they're like, I always take it. And like, I'm just like,
yeah.
I'm not a doctor. I'm not here to give you medical advice. Let's schedule your appointment.
Yeah.
But
Very good. I'm very proud of you. This is awesome. This is great. So I hope you enjoyed this segment. And if you like my content, don't forget to like and subscribe. If you think this video will help someone you know, be sure to repost a link to this video. And as always, I'm Dr. Chanu Dasari with the Mind Gut Immunity Clinic. And let me know if I can help you out.